Well, a very good afternoon, everyone, and a very warm welcome to you all. I am Dr. M. Shia Jaiswal, and on behalf of D-Bridge, it is my great pleasure to welcome you to today's webinar. And the topic is Threads and Injectables, Minimally Invasive Aesthetics. Thank you all for taking the time to join us. Today's webinar has been designed for doctors, oral and maxillofacial surgeons, and aesthetic practitioners who wish to stay updated with the latest Korean innovations in minimally invasive facial rejuvenation. Over the past decade, Korea has become a global leader in aesthetic medicine, introducing advanced techniques that provide natural looking results with minimal downtime. Treatments such as Botox, fillers, and thread lifting have transformed facial rejuvenation, offering patients effective alternatives to surgical procedures. During today's session, we will explore about Botox, dermal fillers, thread lift, current trends shaping the future of Korean aesthetic medicine. Now, it is my great pleasure to introduce our distinguished speaker. We are honored to have with us Dr. Hae Seok from South Korea. Dr. O is a highly respected cosmetic surgeon with extensive experience in minimally invasive facial aesthetics. He is widely recognized as the inventor of the L-shaped nose thread lift, an innovative technique that has gained international attention for non-surgical nasal enhancement. His areas of expertise include facial and body contouring using fillers and threads, advanced thread lift procedures, facial rejuvenation, liposuction and lipofilling, Korean aesthetic treatment protocols. With years of clinical experience and continuous innovation in aesthetic medicine, Dr. O has trained numerous doctors and helped advance minimally invasive cosmetic procedures. We are privileged to have him share his knowledge and expertise with us today. So, before we begin, a housekeeping reminder to all the attendees. This webinar is being recorded, so please keep your microphones muted throughout the session. Feel free to submit your questions in the chat box at any time. We will have a dedicated Q&A session at the end of this lecture. So without further delay, let us begin the session. Dr. O, over to you. Please go ahead with your presentation.
My name is Hae Seok and I'm aesthetic surgeon in Korea.
I'll be translating. He'll be giving lecture in Korean from now on.
네, 오늘 시간에는 제가 그 강남 프로토콜에 대해서 이제 페이셜 에스테틱스에 대해서 인트로덕션 시간을 좀 가져보려고 합니다.
Today he's giving lecture on basic Gangnam Protocol procedures and facial aesthetics limited to minimally invasive treatments.
네, 일단 제 소개를 간단하게 하자면 저는 엘스코라는 이제 코 전용 실 thread 리프트를 만들었고 그리고 실과 필러 영역 그리고 얼굴과 바디의 컨투어링 영역에서 활발히 활동하고 있습니다.
I'm an inventor of L-shaped nose thread PDO thread lift and also expert in the field of filler thread in regards to face and body contouring surgery.
저의 그 워크 익스피리언스를 보시면 대부분의 경력이 되게 미용적으로 활발한 강남 쪽에서 일을 했기 때문에 최신 트렌드나 이런 것들을 누구보다 빨리 접할 수 있는 환경이라서 오늘의 강의도 준비하는 데 있어서 도움이 됐던 것 같습니다.
As you can see, my career path has always been within Gangnam in the heart of aesthetic trend, so I will be able to deliver the latest aesthetic trend from Korea.
네, 일단 시작을 해보겠습니다. 예전에는 어떠한 이제 미용적인 치료는 하나의 그러한 이제 포인트에 집중이 되어 있었습니다.
In the past, the treatments of minimally invasive treatments were limited to just a site-specific, trying to resolve site-specific issues and problems.
예를 들면 나소라비알 폴드가 그 고민이면은 나소라비알 폴드에만 치료가 되는 그런 형식이었죠.
Yeah, for instance, if you have a nasolabial fold and you want to just resolve that by putting fillers around the site.
하지만 요즘에는 이러한 팔자에 대한 치료로서 이렇게 관자 부분부터 그리고 피부 텍스처부터 그 다음에 보톡스를 이용한 근육의 움직임까지 다양한 각도에서 멀티 모달리티 측면으로 치료가 이루어지고 있습니다.
The latest trend now is that you're shifting from single modality treatment to a multi-modality treatment, where you're also using Botox to work around with the cheek muscles, and also using fillers to lift around the side of the face and things like that to improve nasal.
그래서 이제 요즘의 트렌드는 이제 뼈 레벨부터 그리고 근육 그리고 그 위를 덮고 있는 피하 지방층 그리고 마지막에 피부를 감싸는 이제 진피 영역까지 이렇게 멀티 모달리티하게 접근을 하는 방식이 요즘의 트렌드라고 볼 수 있습니다. So from the foundation to the canvas layer, we are dealing with bone and muscle and fat layer and the dermis layer through the various kind of multimodal treatment. Okay, so we have to understand the musculature before we are treating the muscle level. 그래서 저희는 근육의 해부학을 잘 알아야 하며 그다음에 피부의 구성 구조도 잘 알아야 합니다.
Yeah, for the multimodality approach, you need to understand the facial musculature and landmarks, and also it's very important that you understand the different skin layers and the herb injection as well.
네, 같은 보톡스를 주입하더라도 그 해부학을 잘 이해하고 예를 들면 어떠한 근육의 오리진과 인서션 영역과 그 깊이를 잘 알고 치료하는 것과 아무것도 모르고 그 영역에만 주사를 놓는 것은 결과가 확연히 다를 수 있습니다.
End result after Botox filler treatment without an in-depth understanding of skin layers and facial musculature, the end result is very different.
네, 그리고 여기 보시는 것은 이제 트리트먼트 에리아에 대한 내용인데 어떠한 한 얼굴이 있을 때 굉장히 다양한 치료 영역들이 있을 수 있습니다.
Yeah, as you can see, there are different areas that you can apply these fillers or red lift Botox.
네, 누군가는 슬리밍을 원하고 누군가는 더 필링을 원하고 이러한 다양한 니즈들이 혼재되어 있기 때문에 그러한 니즈에 부합하는 치료를 하기 위해서는 해부학적 이해가 필수라고 볼 수 있습니다.
Yeah, some may want more volume to certain areas of the face, or some may want to lose volume from some areas of the face. So it varies from patient to patient. So that's why it's very important for you to understand the anatomy of the face.
네, 그래서 이제 이러한 토탈 페이스 필로소피에 대해서 중요한 부분은 굉장히 자연스러운 그러한 결과를 만들어야 한다는 것이며 그리고 다운타임이 짧아야 한다는 것입니다.
So the key factors on Korean total face philosophy is that you need to create very natural, subtle change of look that no one really notices, but actually says, "Hey, you look better," But have you gotten any treatment? And another thing is there's a short downtime as well versus surgical procedures.
네, 그래서 일단은 non-surgical, minimally invasive treatment 영역에는 크게 이렇게 네 가지 영역이 있습니다. 보톡스 필러, 그다음에 thread lift, 그다음에 바이오스티뮬레이터입니다.
So when we talk about minimally invasive facial aesthetics treatment, we are really down to talk about these four things: thread lift, Botox, fillers, and biostimulators.
그래서 먼저 이제 톡신에 대해서 대략적으로 설명을 드리면 톡신의 역할은 과거에는 근육을 마비시키는 것에 불과했습니다.
So let's talk about Botox first. So when it comes to a very classical way of using Botox was to really minimize movement of muscles by injecting Botox to a certain size.
그래서 보통은 주름을 예방하거나 아니면 사용하지 않음으로써 점점 근육 사이즈가 줄어서 볼륨을 줄이는 용도로만 사용했습니다.
Yeah, so the use of that was to either reduce wrinkles around that area, or to prevent creation of wrinkles in the area, or reduce the size of the muscle by reducing the movement of the muscle around the site.
하지만 요즘 들어서 보톡스는 피부 진피 부분에 작용해가지고 다양한 영역의 효과를 나타내고 있는데 가령 예를 들면 얼굴이 붉어지는 홍조라든지 그다음에 피지가 많이 분비되는 그런 지성적인 피부라든지 아니면 탈모 그리고 뭐 여러 가지 염증을 조절하는 영역까지도 작용할 수 있습니다.
But it has the use of Botox has moved on from just working the muscles, but to more superficial area where you can reduce amount of sebums from your skin to reduces more acne-prone skin to less acne-prone skin, or even reduce redness from the face. So it reduces inflammation from skin.
네, 그리고 필러에 대해서 말씀드릴 건데 필러는 어, 예전에는 이제 볼륨을 채우는 그런 용도로만 사용을 했습니다.
Okay, so talking about the fillers now, in the past, it used to be just focused on giving more volume to where the spots where it needs more volume around the face.
그런데 이제 요즘의 트리트먼트는 우리 얼굴의 구조에 해부학적으로 깊이 있는 뼈부터 올라오는 그러한 유지인대 부분들을 좀 더 나이가 들면서 처지는 것을 스트레칭 시켜주는 역할로서 각각 얼굴에 작용할 수 있는 그런 부위에 주입을 함으로써 전체적인 얼굴을 팽팽하게 해주는 역할로도 쓰이고 있습니다.
Yes, now these days it's more used on kind of reconstructing age face where you really change the contour of the face by working on the level.
네, 그래서 특히 에이징 된 얼굴은 보통 이렇게 트라이앵글 쉐입으로 바뀌는데 그런 부분들을 이렇게 리버스 트라이앵글 쉐입으로 바꿔주기 위해서 필러를 사용할 수 있고
So aging face usually has a triangular approach on the face where it's marked there, but then they try to reverse the triangle to get more youthful look on the face.
네, 그리고 때때로는 근육의 움직임 위에 작용해서 근육의 움직임을 조금 저하시켜가지고 이러한 턱에 있는 자갈턱 같은 주름이나 아니면 뭐 이마나 눈가에 있는 그런 주름에도 좋은 영향을 줄 수 있습니다.
It can also be used to minimize fine wrinkles around forehead, around the eyes, and around chin as well.
네, 그래서 이제 필러를 넣는 방식은 여기 linear threading, fanning, 그다음에 depart technique이라고 나와 있는데 실제로 굉장히 다양하게 이것을 넘어서는 다양한 주입 방식들이 있고 그러한 주입 방식들도 앞으로 기회가 되면은 설명드릴 수 있으면 좋을 것 같습니다.
Here we have only listed 3 different techniques of injecting fillers, but there are way more other techniques that's available and used clinically on day-to-day basis. So yeah, we'll be introducing other techniques along the way in other lectures.
네, 그래서 이제 필러에 대한 그 필러 자체에 대해서 좀 말씀드리면 필러는 이제 G 프라임 값에 따라서 크게 하드, 미디엄, 소프트로 나눌 수 있고 그 각각의 G 프라임 값에 적절한 주입 깊이나 그리고 대체하고자 하는 조직의 종류가 다 달라지기 때문에 이러한 것을 적절히 선택하는 것도 굉장히 중요합니다.
Yes, so usually the fillers are available in hard, soft, or medium, depending on G prime value. So it's very important for you to be able to select which one to use on different application or spots that you're clinically trying to apply.
네, 그래서 이제 여기 나와 있는 거는 레이어링 스트래티지라고 나와 있는데 이 말은 결국은 이제 깊이 있는 조직을 대체할 때는 좀 더 G 프라임이 높은 것을 사용할 거고 점점 더 슈퍼피셜한 조직을 대체할 때는 좀 더 낮은 G 프라임 값을 사용한다는 그런 큰 틀을 보여주고 있습니다.
So this diagram just explains how in the deeper layer of the skin we need a higher value of G prime and the other way around, vice versa.
그래서 뭐 예시로 들면 뭐 턱과 그다음에 이 조 라인 같은 경우는 뭐 하드한 필러가 필요하고 그다음에 나솔라비얼 폴드 같은 경우는 뭐 하드한 것과 미디엄 소프트한 거를 섞어서 쓸 수 있고 이러한 것들을 예시로 보여줄 수 있습니다.
So this table just indicates few examples of which G prime fillers are more effective or recommended for different sites of treatment.
네, 그리고 얼굴뿐 아니라 바디 필러도 굉장히 인기를 끌고 있는데요. 주로 뭐 어깨를 좀 더 직각처럼 보이게끔 하기 위한 어깨 필러가 있고, 그다음에 엉덩이에 이제 힙 딥 하이라고 불리우는 영역을 좀 채우고 좀 더 엉덩이를 볼륨 있게 하기 위해 힙 필러도 굉장히 인기가 있습니다.
Yeah, you may think the fillers are only applicable for face only, but it's trending and used globally, applied globally on like giving more volume to saggy, a bum or about the neckline or even shoulders. It's been becoming quite popular also globally.
네, 이제 스레드에 대한 얘기를 해볼 건데요. 스레드는 모노 스레드랑 코그 스레드 이렇게 크게 두 가지로 나뉩니다.
So the threads are actually split into two different types. One is called mono, and the other is called cog. Okay, some companies also offer screw or mesh type as well.
네, 그 스크류랑 메쉬도 결국은 모노로 조작이 된 건데, 이러한 모노들의 역할은 주로 콜라겐을 생성하는 역할을 합니다.
The screw or mesh type are deviation from monotype, but that's used to promote more collagen growth under skin or to lock in fillers into that site of thread insertion.
네, 그리고 이런 콜라겐 생성을 촉진하면서 이 실들을 좀 더 많은 볼륨을 넣게 되면 이 실들 자체가 필러의 역할을 할 수도 있습니다.
When it comes to mono threads, if you put a lot of mono threads into one same site, it can act as a filler as well.
그리고 이제 코그는 결국은 걸리는 파트가 있는 건데, 이게 걸려서 하는 역할은 서브큐테니어스 팻을 재배치, 리포지셔닝 시켜주는 역할을 합니다.
So these cork threads have this lifting parts on the thread. So this lift has the effect of lifting subcutaneous layer of skin.
그리고 이제 실은 뭐 PDO, PCL, PLCL 이렇게 크게 세 가지 종류로 나뉘는데, PDO는 좀 더 탄력이 있는 반면에 유지 티슈 안에서 이제 디그라데이션 피리어드가 조금 짧다라는 게 있고, PCL은 약간 이제 탄력은 조금 떨어지지만 그러한 티슈 안에서의 디그라데이션이 굉장히 롱 피리어드라는 특징이 있는데, PLCL은 똑같이 PDO처럼 탄력이 있으면서도 PCL과 가까이 좀 더 유지 기간이 길어졌다는 그런 특징이 있어서 각각이 다 다른 특징을 갖고 있습니다.
As you can see, the difference, the threads are available in both PDO or PLCL forms. Its elasticity varies between the two. So in general, PLCL lasts longer than PDO.
네, 그래서 결국은 이제 이 얼굴을 보면 볼륨을 채워야 하는 곳에 필러를 넣고, 그리고 그 위에 이제 스킨 부스터도 깔아주면서 피부의 텍스처를 좋게 만들고, 그 다음에 이제 팻 리포지셔닝이 필요한 곳에는 이제 스레드 리프트를 하고, 이러한 다양한 멀티 모달리티적인 치료를 해볼 수 있다라는 것을 표현한 표입니다. So this diagram shows so it depending on the beginner, medium experience level, you can be able to use Botox or filler and PDO monothread and coke thread to treat the treat the face with a different modality. And this is some pictures of the before and after the coke thread lift, but remember that when it comes to treating nasolabial fold or marionette line, it is important to not only use filler, but also thread lift and skin booster together makes the best outcomes comparing to the result when we only use the single modality. So now I'm going to talk about the biostimulator. It is also called skin booster in AKA skin booster, right? So Koreans are famous for have a very glow skin, glass skin, because many Koreans go to the skincare clinic or skincare shop to get some treatment. And most of the treatments are focused on hydration and anti-inflammatory, uh, anti-inflammation, and those two, hydration and anti-inflammation and rejuvenation. So, okay, this is the table that I just explained. So we use the Botox a lot since very early 2000 year. So many patients who continuously received the botulinum toxin treatments, they developed uh, resistance. So the treatment effect starts to reduce because of the resistance. So many companies are developing other way of inventing the botulinum toxin that actions differently to reduce the resistance. And what I'm going to introduce you is this Wellstock's vegan tox. That is, most of the botulinum toxin currently available um, are produced, manufactured with uh, animal-based derived components. But this one used the vegan mechanism, vegan way, that it has no animal protein allergic reactions. And plus it formulated with the L-histidine so that it has antioxidant effects too. So this Wellstock's can be a good option in the skin Botox treatment. So what I mentioned earlier, thread, filler, and toxin, and uh, skin booster, they are all have it can all have the complications. So we have to know what complications we can have and how to manage it, and we have to know how to notice the complication. So these are just general complications: bruising, swelling, lump, infection, and inflammatory reaction: early inflammatory, delayed inflammatory, and Tyndall effect, migration. Uh, those are common, and also we have more serious complications like vascular occlusions. This is very important, and we have to know how to manage the vascular occlusion, and we have to equip the proper uh, medications or surgical equipment to do action when the vascular occlusion happens. So in the later lecture, if possible, then I can explain how to manage the very emergent vascular occlusion event. So, but yeah, a Botox diffusion can differ by how we dilute the botulinum toxin. So we can also adjust the diffusion rate to make a different result. But in the clinical setting, we just do the same diffusion, same dilution rate. And also, Botox diffusion can make adverse effect. So we have to know this mechanism also. And thread lift complications are very mechanical because thread coats directly get the skin, and it just pull the skin to make this dimple sign. So it is really important to notice this sign at the very hopefully right after the thread lift, and we have to manage it early, because if the time if time goes past, then it might be difficult to manage it. Okay, so there are also different kind of complications and different kind of management in to the complications. So this kit, emergency kit, is just, you can see, these are the emergency kit when we have the vascular occlusion event and clinical cases. Okay. So I think that's all for today's introduction class about the minimally invasive modality for Korean clinical aesthetic.
Thank
Thank
you
you.
so much, Dr. O, as it was an introductory session. So yeah, it was a very insightful and educational presentation. So I'm sure that everyone learned a great deal about the latest Korean approaches to minimally invasive aesthetic treatment. To all our attendees, if you have any question, you can raise your hand or you can write anything in your chat in the chat box or Q&A box. We will take it shortly. Meanwhile, I would like to present my presentation, and I would like to introduce about D-Bridge. So let me share my screen. Is it visible? Yeah, okay. So basically, I have those who have attended before, they know about the D-Bridge, but again, those who are new and want to know about what D-Bridge is and what we do. So yeah, here we are. So D-Bridge is an integrated platform which is basically dedicated to briefly dedicated to bridge global expertise with local clinical practice, and we are Korea based medical and dental platform that connects education community and clinically proven technology. And yes, our vision is to democratize access to high quality medical education and innovative technologies, empowering healthcare professionals to deliver safer and more predictable and evidence based patient care. Well, our guiding philosophy is learn, apply, and share. And yeah, we are proud to offer unique opportunities for our clinical partners. Active engagement with D-Bridge unlocks exclusive benefits, including sponsorship opportunities, KOL collaborations, access to international speaker and experts, invitation as a guest speaker at webinar and conferences. And yes, a special course discount can be also given, but it is subjected to terms and conditions. So this is our website. You may visit our website to explore educational courses and online marketplace featuring curated dental and aesthetic products. Well, we are also active across multiple social media platforms where we regularly share about educational content and updates and upcoming events. These are some of the key highlights of our company. Yeah, this is our dedicated team, small in size yet impactful in vision. And here are some of our valued global partners. Well, today's webinar is just the beginning of minimal aesthetic, invasive aesthetic course. So yeah, at D-Bridge, we are excited to announce that we will be soon launching a series of advanced educational programs in collaboration with the experienced Korean aesthetic specialist. So basically, these programs are being designed to provide theoretical as well as practical clinical training in Botox, dermal fillers, thread lift, and facial contouring, as well as advanced Korean aesthetic techniques. So we are also working on multiple certification pathways, including internationally recognized Korean certification options, allowing clinicians to from different backgrounds to choose the learning format that best suits their professional goals. So as Dr. already highlighted during his presentation about Botox, fillers, and thread lifts. So I will be talking about our product, one of the product, which is Botox. So it is widely used. We all know that it is used in dentistry, in neurology, but it is majorly used in aesthetics and dermatology section. So we need to be very careful when we are administering Botox in orofacial region. We should have a precise anatomical knowledge and careful identification of target sites that are essential to avoid the potential complications. So Botox, as I said, that it is extensively used in aesthetic medicine and dermatology, and is delivered in different techniques. As you can see here, like there is something that is mesobotox, microbotox, deep injections. There are so many things. So we will take these topics in next webinar and or maybe next course. So yeah. So this is a product that is a Wellstox. It is a next generation Botox, and the key feature of this Botox include it is a world's first vegan Botox formulation. It has dual effect, like it also relaxes the muscle as well as it also helps in skin rejuvenation. So it is designed to address concerns related to Botox type A resistance, as Dr. O already explained about it. And this is basically a third generation Botox and is halal certified and fully registered and compliant with the regulatory standards. Yeah. And yes, you can see here there's a comparison of some Botox injection with Wellstocks, and yeah, it can be used in various ways. Okay, and now talking about, like, let's move on another category, that in facial aesthetic, that is dermal fillers. So today I would like to introduce Eglin HA filler. It is a premium Korean HA filler that is hyaluronic acid filler designed to deliver natural looking, safe, and long lasting aesthetic results. Allen fillers are available in 3 different formulations. So you can see here that each is specifically designed for different treatment depths and facial indication, like that is volume 1, volume 2, and volume 3. And this allows clinicians to choose the most appropriate product based on the treatment area and the desired outcome, whether for fine lines near to the crowfit, or in the nasal level for moderate volume restorations, or maybe deeper facial contouring. So one of the key advantage of Aline fillers is that their excellent safety profile. The product contains less than 2 ppm of residual BDDE. It is well below accepted safety limits, and the endotoxin level is less than 0.1 EU per gram. So ensuring a highly purified filler with minimal hazardous impurities. And another notable feature you can find is that it has optimized hyaluronic acid formulation, which helps minimize post-treatment swelling and edema. These contributes to greater patient's comfort and faster recovery following the procedure. And in the unlikely event that correction is required, Ellen fillers can be effectively dissolved using hyaluronidase with the rapid degradation, typically beginning within approximately 2 hours, leaving minimal residual material. So this filler demonstrates high viscoelasticity, providing excellent structure support while maintaining a natural facial movement. And it also utilizes a multi-layered hybrid hyaluronic acid technology, which enhances stability and improve the tissue integration, and significantly reduces the risk of product migration after injection. In addition, its optimized formulation allows for smooth injection with the reduced discomfort, making the treatment more comfortable for patient. So finally, this Aline fillers, it is manufactured in CGMP certified facilities, ensuring stringent quality control, consistency, and compliance with international manufacturing standards. So overall, this Ellen combines the safety, purity, durability, and excellent handling characteristics, making it a reliable choice for clinicians seeking a predictable and natural aesthetic outcomes. So if you guys have any sort of questions or information and want to know anything about the Wellstocks and Ellen, so if you're interested in purchasing opportunities, so please feel free to DM us, or you can contact us via email or WhatsApp. And yes, we are also excited to announce that DBridge is currently preparing to launch an advanced education program on TMD management and facial Botox application in collaboration with an experienced Korean professor, that is from Yonsei University, which is one of the renowned university in like all over the world, yeah, and with the clinical experts. So the course is being designed to provide participants with both theoretical knowledge and practical clinical insights. So we are also exploring, as I said before, that we are exploring multiple certification pathway for this program. And yeah, so there is also, you can see there's also one-time opportunity for Indian doctors especially. So doctor who purchase Botox or fillers from us, like through DBridge, terms and conditions applied. So you can DM us for more, and yeah, will become eligible for an exclusive training program in Bali. So you can see here that what is covered. So we will cover flight tickets, accommodation, hands-on training, and course fee. And you can also get a chance for exclusive networking event with international aesthetic expert. Here you can see the roster over here, that there are different moderators and from across the world who will be coming here, and this is a rare opportunity to learn from global leaders while enjoying the beautiful island of Bali. So this Bali program, it brings together internationally recognized aesthetic experts for advanced academic sessions and clinical discussions. So as I told, that if only a limited number of seats are reserved for Indian doctors, so hurry up and don't miss this chance. Since this program is open internationally, these seats cannot be held for long. So yeah. And yeah, you can contact us if you have any queries or any doubt. And if you want to purchase anything, you can contact us via WhatsApp or email. And yes, your input is extremely valuable to us. So we would greatly appreciate if you could complete the feedback survey and indicate your level of interest in participating in this program or maybe in the Bali event. Okay. So thank you. And now let's talk about the Q&A. And yeah, let me check for the questions if I have received anything. Okay, hold on. So there are few questions that I received from Google form. So first, let's take that question. Yeah, okay, hold on. Yeah, the first question is patient selection for injectables. So I mean, maybe this person wants to ask that how you can select the patient for injectables, like how you will decide that which patient will go for which treatment modalities, whether it's Botox, fillers, or thread lift. Doctor, if you can answer.
제 질문을 좀
You
저희
are
드리자면,
mute.
이분, can you hear me?
Yeah.
Okay. So I'm just translating the question to Dr. O. 어떤 환자 진단에 있어서 그러니까 보톡스 환자인지 필러 환자인지 어떻게 진단을 하냐, 뭐가 필요한지를 진단을 하냐 이 질문인 것 같아요. 예.
네네. 질문은 어쨌든 저도 알아들어가지고 해석 안 하셔도 될 것 같습니다. 질문은. 네. 어, so the filler is fill plus ER. So when you decide which patients to have a filler injection, then it means that the patients need to be filled somewhere. So there must be volume depletion on his or her face. So it's very simple. You cannot fill somebody who's already have a full volume on their face. So that's very simple and important thing. And other injectables are Botox and maybe thread lift that also works in a similar way. So if they have hyperactive muscle activities, then you can choose to inject botulinum toxin and it's like that.
Okay, thank you. So the next question is choosing between fillers and thread lifts. According to you, doctor, which one is more good, like filler or thread lift? Which will you choose?
That's also when comparing these two is actually not a good question because filler also have its own strengths and thread lift also has its own strengths. So when you want to make a patient's face beautiful by filling some volume, then you have to choose filler. But when somebody's face have enough volume, but the problem is the sagging part, sagging of the skin on certain area, then thread lift can be a perfect option. So that's very simple.
Okay, yeah, thank you. And the last question is clinical pearls for achieving natural looking outcomes. So yeah, how to achieve natural looking outcome?
Yes, that's this question is very good question, and by learning and by experiencing this minimal invasive treatment, as you are working in this field, then the natural means it should be the way it is born with. So you have to make some results that somebody is born like that already. So when you're feeling chin, then when you're making chin, very high G prime value filler should be placed in the just right upper area of the bone to replace the bone volume. And for the more superficial layer, that is a fat layer. So you have to use less G prime filler to make the subcutaneous volume. So that's a very key point of making natural result.
Okay. Thank you. So now let's check the chat box. So we have one question from Farhan Khan. Nice presentation. What resources or books would you suggest to read more about these aesthetic procedures?
I think these days there are many materials you can access through YouTube or ChatGPT like AI. But if you are trying to study in depth level, then I would recommend the book written by Dr. Hong Gi-ung. He is very highly experienced. He's very uh, old, but he's very experienced, and he's a board certified plastic surgeon. But he does not do surgeries. He's only do the minimally invasive treatments. So I highly recommend buying his book and read.
Okay. So I hope you have got your answer, Farhan. If you have any other questions, you may put in your in the chat box. And yeah, meanwhile, yeah, there are no more questions. There's one more question from Sandeep Sharma. Yes, may I know what's that? You can unmute yourself and you can ask your question. What's the common mistake done by doctors?
So common mistakes done by doctors, especially when they are in assessing volume.
Yeah, in assessing volume.
Uh, in assessing volume. So I think in the very early when they're new to the aesthetic field, they are very confused of what is beautiful, what is natural, what is not natural, what is ugly.
Yeah.
So those are very important thing that you have to develop. So I think everyone has different bone and different muscle. So it is really important to know how, let's say, some patients comes and you have to see what is the best natural look of in this setting, not just comparing to the famous actress or beautiful people. Just always we have to focus on that individual. I think that's important.
Okay. So
Thank you, doctor. Is there any just one question more? Is there any app or any device which, with the help of AI, a doctor can assess the volume of how much is to be given?
Is there any app or AI?
any application or any AI that can assess the volume of the patient? Is there any AI or app?
AI or app? I think this is really about art, and maybe there's it can be developed, but not that I know of. There's nothing like that currently. Yeah.
Okay.
May I just add on to that? It really depends on the patient's needs. Some patient may want subtle change. Some patient may want very dramatic change, right?
Right.
So it's very important that you communicate throughout the whole procedure if they're satisfied with the volume that's been injected or the amount that's been lifted from your base. So that's why, of course, when it comes to the pain level, then you may want to do it on the general aesthetics. But that way, the end result, only the doctor is responsible for the end result, right? But when it comes to facial aesthetics, it's all about the patient satisfactory. So it's most important that, throughout the procedure, you communicate with the patient, whether it's the right volume, or they feel that they need more or less. Yeah.
Okay, so there are no more questions. Thank you everyone for joining with us. And yeah, I would like to extend my sincere gratitude to Dr. O for sharing his valuable expertise and insights into this. And of course, Ms. Lena, CEO of D-Bridge, for providing this educational platform. And of course, most importantly, our attendees for your enthusiasm participation. So today's session especially highlighted the important concept in minimally invasive aesthetic, that is Botox, dermal fillers, and thread lifts. Each have unique indications and should be selected based on patient anatomy, their aging patterns, and treatment goals. And this thread lifting offers an effective, minimally invasive option for face lifting and contour enhancement while stimulating the collagen production. Natural looking results depend on precise anatomical knowledge, appropriate product selection, as I told before, and refined injection techniques. And thus patient safety, proper technique, and complication prevention and realistic expectation remain the foundation of successful aesthetic practice. So you can get this by having the continuous education and hands-on clinical training. These things are very essential for any practitioners who wish to remain current with rapidly evolving aesthetic technologies. So yes, Yeah, and now we are about to end, so don't forget to complete the feedback survey, and we look forward to welcoming you to our future webinar, workshop, or any educational event or courses. So until then, stay safe, stay healthy, and keep spreading knowledge, and continue to embody our motto, that is learn, apply, and share. So thank you everyone, and have a wonderful evening. Thank you everyone for joining us. Thank you so much.
Thank you so much.
Thank you.